Good afternoon, friends. So, how was the weekend? Well, mine was exciting. So, in reference to my weekend, which includes a lot of obstetrics and labor, so a lot of patients have asked me during the antenatal checkups in their third trimester and when they are nearing a term, which is the time for delivery, but how will they know when they go into labor? Well, there are 3 to 5 very common signs which a woman has to undergo. One of them, most commonly seen, is abdominal pain, where the entire lower abdomen, which is the abdomen which is full of the uterus, the full-term uterus, is severely contracted. I would say a painful, tender abdomen up to stony hard abdomen. This is the range, I would say, but the intensity causes of the contraction causes severe abdominal pain. That's the first one. The second one, also seen very commonly, is the breaking of the water, which is the amniotic membrane. The water breaking is again a sign of labor, and there's fluid like vaginal discharge as good as water, which completely drenches the clothes the woman is wearing. The third sign is passing of show. Show is bloody discharge, which is mucousy in consistency. It could be even bloodstained or just a few drops of blood. But these 3 signs are the most common. The fourth sign is reduced fetal movements. Reduced fetal movements is a slightly ominous sign which can happen anytime in the third trimester. But reduced fetal movements, reducing drastically, is a must go to the gynecologist and obstetrician's office. You cannot think over it and say you'll wait, you'll watch, you'll observe. Ideally, a woman should have 10 to 12 fetal movements a day, even in the third trimester, specifically after her meals. Lower glucose intake, blood pressure medication, and when the baby is asleep can cause reduced fetal movements. But we have to understand that reduced fetal movements is not a good sign in the third trimester. It could be a false alarm. Never mind. One trip to the gynecologist's office and getting an NST done or an ultrasound with a color Doppler done is no harm. Second, as I said, is fluid vaginal discharge, which is called leaking per vaginum or breaking of the amniotic membrane. Third is passage of blood or show. And the fourth is uterine contractions or abdominal pain. Any of these 4 signs, don't think. Dial your gynecologist's office and be there on the way, and make sure you have a secure delivery. Thank you. All the best.